Do you have shoulder pain? Well, you're in the right place. My name's Dr. Jared Bornstein from NJ Health Performance in East Brunswick, and today I'm going to be showing off how we do an exam on the shoulder and how we isolate exactly where the problem in your shoulder is. So come on in, let's go through an exam. All right, so we have our patient here. She's saying she's having shoulder pain. I'm not going to go through the first part because the first part is actually ruling out the cervical spine or the neck. 50% of shoulder pain is actually coming from the neck. So that's a different video. Right now, we're going to pretend she doesn't have any neck issues causing referred pain into the shoulder, and we're going to evaluate just the shoulder. So the first thing we're going to do is go through some ranges of motion. I'm going to have you take your arm out like this. You're going to come straight up like that. And I'm looking for full range of motion, and that's full. We're testing one of the rotator cuff muscles with that called the supraspinatus. Then I'm going to have you come straight up forward like that. Any pain with that? We're also checking the flexors of the shoulder with that one. I'm going to have you come out like this. We're just looking for full range of motion and pain-free range of motion. So you're going to roll out like this. That's the external rotators of the rotator cuff. Any pain with that? And then we're coming in here. Any pain with that? And that's the internal rotators. So that's testing the rotator cuff. Next thing I'm going to do is do some orthopedic testing to isolate if it's coming from the joint or coming from the muscles, whether that's a strain, sprain. We're gonna be able to differentiate that with these next few tests. So stay right there. You're gonna come out like this, come in like that. So I'm gonna test the bad shoulder first. You're just gonna push up. Is there any pain with that? And then you're gonna push up here. Any pain with that? Cool. So that's telling me that the rotator cuff is intact. So she's having some shoulder pain, so it might be more related to the joint. So now we're going to kind of jump into joint-related testing, and now we're going to kind of pinpoint exactly what's going on. So this next one's going to hurt. I don't care. All right. You're going to bring your arm like that, and you're going to keep your hand flat, and what you're going to do is raise your elbow. All right, so we did that incorrectly. We're going to try again. You want to keep your hand flat.
Okay.
Perfect. Raise your elbow. Is that painful? We're going to do it again. This one's gonna hurt.
Oh, okay. Okay, cool.
All right, so we have our hand flat like this. We're raising our elbow like that. And the key point to this one is you want to keep your hand flat. Does that one hurt?
Mm-hmm.
All right, so that one's painful. It's positive for pain. You can drop that. That means that there's an issue with the labrum, and that's called Dugas's test. So the labrum is an extra piece of cartilage that holds your humerus into the shoulder joint, and it extends and make sure it stays in there. If that's torn or frayed, it can cause pain, and this is like stressing that area to make sure, and that's how we know if it's painful that might be one of the sources of pain. That's going to dictate our treatment plan, our rehab protocol. All right, we're going to do 2 more tests. We're going to do something called Apley scratch. It's called Apley scratch test because it looks like you're scratching your back. So all you're going to do is reach over. We'll do your good hand first. You're going to reach over and try and scratch your back. Any pain with that? Cool. And then we're going to try the other one. Is there any pain with that?
Yes.
There is pain with that one. Okay. So that kind of tests a little bit of everything, but it's really isolating the rotator cuff. So the other ranges of motion in this part of the exam were fine, but now when we try to do the orthopedic test to do the Apley scratch, she's having some pain. So that tells me that there's a labrum issue and there might be some kind of strain, sprain of the rotator cuff. So now we're gonna tell her what our treatment plan is, and we go from there. So that's how we kind of evaluate the shoulder and pinpoint exactly what's going on, because there's a lot of things and that can cause problems. If you have shoulder pain, give us a call. We'll make sure you get the right rehab.